How many registered?
45.
Okay, thanks.
Good afternoon, Alameda County RCFEs and ARF facility staff and administrators. We are so excited to have you with us on Monday, April 19th to update you on some exciting developments that we have here in Alameda County and talk about some specific testing updates and some opportunities that Alameda County is providing for us. So I just want to remind everyone that we do record the session. We will provide you the slides and the recording tomorrow, so you don't need to be present. If you're not able to be, you can share it with a staff member. And with that, I'm going to turn it over to David.
Great, thank you, Nicole. Hello, everybody. Thanks so much for taking time out of your busy day to join us for this important webinar. I think you know we're kind of on the cusp of RCFEs and ELFs and assisted living and memory care having the opportunity to access point of care antigen test kits and utilize those even without a CLIA waiver. So the intent of our webinar today is to set you up to take advantage of those free test kits and start using them as soon as CDSS releases additional guidance, which we think could happen this week. But for now, just a couple of quick updates here before I turn it over to Christina. Remember, you still can gain access to the vaccine doses. Last week, CDSS did release a PIN that included some of this information. However, it didn't include the information about that you can still go to the Alameda County pods. You can bring residents to the pods or staff in order to get vaccinated. Or alternatively, you can send us a request through this Smartsheet app where you're requesting that we utilize our vaccine doses and give them to skilled nursing pharmacy to go over and set up a clinic for your staff and residents. And skilled nursing pharmacy is doing a fantastic job. Maybe some of you have already been served. So far, since the CDC Federal Pharmacy Partnership ended, they've definitely stepped up to help fill the gap to make sure the long-term care facilities in our county still have access to the vaccine. We have 53 requests that have come in from long-term care facility providers for mobile vaccine clinics to be held at their facility, and SNP has already finished 41 of those clinics and administered 550 doses to residents and staff. So this program is going well. We encourage you to keep asking hospitals to vaccinate folks before they arrive, to keep contacting your local pharmacy where you get all your meds for your residents from to see if they have vaccine supply, to keep going to the pods for people who want to get vaccinated. And as a last resort, if you need a mobile clinic, we have that available to you as well. Oh, there's the data on the great work that skilled nursing pharmacy is doing for us, hosting mobile clinics in our long-term care facilities here in Alameda County. So do you think testing is going to stop anytime soon? Unfortunately, not. Skilled nursing facilities are still required to test 100% of their staff every single week as a form of surveillance. RCFEs and ALFs and assisted living and memory care, if you're 7 beds or more, you're required to test 50% of your staff each week. If you're 6 beds or less, you're required to test 25% of your staff each week. It's not going to stop for a while. Why? Because we're seeing cases increase as almost 20% of the counties in the United States. We're still slowly rolling out the vaccine. California is ahead of most states. The rising community case rates in places like Michigan make us all worried. And it puts CDC and CDPH on high alert that they don't want to pull back on testing when you see what's happening in the state of Michigan and in Michigan nursing homes. Number 4, there's the unknown duration of the effect of any given vaccine. We're still a big experiment project in terms of determining how long the vaccine will give us protection. Number 5, mutations. Number 6, the vaccine doesn't completely protect people, right? 95%, 96% is not 100%. And number 7, not everyone is vaccinated. So testing will continue. Testing has to continue because the evidence suggests that if we don't test our staff, very bad things happen in long-term care facilities. Now, we're going to give you this great webinar on the Abbott Binax Now and some other information, but keep in mind that these test kits are free to you and you can access them by making sure that you have an account and then clicking on this link that you see on this page in order to order your Abbott Binax Now. We anticipate that you'll be able to utilize the Abbott Binax Now test kits as a result of the PIN that was released 2 weeks ago, 2116, which indicated within the body of this PIN that another PIN would be released, allowing you to utilize the point-of-care antigen test kits that deliver results in 15 minutes without a CLIA waiver. In addition, Christina, who was on the call today and will be delivering the bulk of the presentation, can also provide further clarity around what CDPH is allowing of RCFEs with point of care antigen test kits. So that's our goal with you today. It's to set you up to be able to confidently use point of care testing on your staff and to do it for free, because we do not believe that our health officer order or CDPH is going to back off on their testing requirements of you. We want you to keep testing. It's important because 50% of carriers are asymptomatic. So that's our goal with you today. And with that, I'll turn it over to Christina. Thank you so much for being here. Oh, before I go, just to alert you, 2 PINs were released recently. There's going to be an informational call on Wednesday from 1:15 to 3. Let's see, and then 2120 is just options for accessing the vaccine. However, you have additional options because you're here in Alameda County. And with that, I will go ahead and stop sharing my screen and turn it over to Christina. Thank you, Christina.
You're welcome. Thank you, David. Thanks for the warm introduction. And it's good to be talking to everyone on this call. I'm here as the Public Health Lab Director and giving you an overview of the antigen test, the Binax Now kit. And so I don't have a fancy presentation, but I'm going to kind of show you the different kits through the video. So this is the kit for the Binax Now. In this kit, you will receive 1 swab that is the control swab that you should use to make sure that the kit is working. So you'll see something like this, and it is the positive control swab. Here is the test card that you'll be using. Here is the buffer that you'll be using. It is a very, very easy system. And so they have directions included with the kit, a nice 1-page pictorial here, but I'm just giving you a broad overview. And so to use this kit, one, as David had mentioned, there's a PIN that came out that said that you can use it without the CLIA waiver. If you wanted to, you can also reach out to CDPH and utilize a CDPH CLIA waiver. I can provide that information for you at the end of the email and how to reach them. But yeah, you have these 2 options now, which is great. With this kit, you'll be able to tell right away if someone is positive or negative within 15 minutes. And you'll have this, it's a fancy little card here, and you'll see for 2 lines, it's positive, for 1 line, it's negative. And you're just reading it based on this. So it's kind of like a very easy, almost like at-home pregnancy test. And so with the card laid flat on the table, and I'm just picking this up for demonstration purposes only, but this card will be flat on the table. You'll see that there's these 2 holes. Hopefully you can kind of see it. I'm trying to angle it so you can kind of see it. There's a top hole and a bottom hole. This top hole is where you'll put 6 drops of this liquid. And it's going to be 6 drops for a patient sample, but 8 drops if you're testing the positive control. All those instructions are on the easy 1-page card. The other thing that they want to mention is that do not angle the bottle this way. Always hold the bottle straight up and down to deliver the drops, and deliver the drops slowly. So the 6 drops will be nice and slow so that the hole does not get overwhelmed. Once that hole has the liquid, you then have your patient take their sample, obviously using gloves, using proper PPE. You can just do a nasal swab, anterior nary swab inside both sides, right and left nostril, and then you'll stick it in the bottom, this bottom hole, and then have it go all the way, reach to the top, and you'll turn it 3 times to turn it 3 times to your right, 3 times to your left. Remove the adhesive that's on here, and then close it so it kind of looks like a lollipop at the end. The liquid will slowly come up, and then if there are 2 lines, it means you're positive. If there's 1 line, it means you're negative. And it's about a 15-minute test. So it's very straight and very straightforward. As you know, the antigen test is technically less sensitive than a PCR test. It usually captures the people that are most infectious. And just know that there could be false negatives, there could be false positives. So those are just kind of things that you want to watch out for. And especially if you're just starting learning how to use this and you're not usually running any tests in your facility, we've recommended that you do a parallel comparison. So run your antigen test, but also submit and collect a sample for a PCR test, so that you can feel confident that you're treating the samples properly, that there's no cross-contamination, and that it's working in your hands. And so I will stop there and see if anyone has any questions about this antigen test.
So Christina, with such a simple swab technique, it's probably fine for an employee in an RCFE to swab themselves and hand the long Q-tip back to the person who's utilizing the test kit?
Yes, you could do that, or the person themselves could easily just get a swab, grab this card, grab the little, diluent, and just add it themselves.
Mm-hmm.
Just as long as you feel comfortable kind of inserting the swab into the card, doing the twists, then you should be fine.
Yeah. So in order to get folks kind of comfortable with this, as Christina said, it's always wise to make sure you're utilizing it correctly. So if you're a large provider, let's say as big as Acacia Creek or something, and you're having to test 50% of your staff each week, it would be wise for you to order these Abbott Binax now, start to get comfortable with them, run some parallel tests next week on about 30 of your staff or 40 of your staff. Send those PCR results in like you always do, get the results back, see if they match up with the samples that you collected on the Abbott Binax Now test kits. Is that right, Christina? Yeah.
Sounds
So
good.
it just gives your staff confidence that they're collecting it and reading it correctly, in anticipation again of you being able to switch and save a lot of money by at least once if I were a big facility with Acacia Creek, I might be inclined to use the Abbott Binax Now on 50% of the staff 1 week, which is required. And then the next 50%, maybe I'd use the PCR test the following week, and then 50% the point of care. That's how many of the nursing homes would do it when they had to test twice a week. Their cadence would go between the point of care and the PCR. What are your thoughts on that, Christina?
Yeah, I think any of those options work totally well. If you wanted to just focus on antigen tests, you can do that as well. Or like David said, 50% antigen, another 50% PCR. I'm also going to introduce you to a small point of care PCR instrument called Q Health point of care test that you can also utilize and order from our facility as well. So there's definitely multiple options for you to make testing and reporting very easy.
Yes.
And just kind of making a plug about reporting, there recently was a guidance from CDPH release that indicated that positives needed to be reported right away. But then for negative antigen tests, you can kind of submit an aggregate number at the end of each week or biweekly to update the public to update the public health department.
Yeah.
So hopefully that makes it even
Right.
easier
We
for
heard
everyone.
that last week. Thank you for mentioning that. Let's see. The other options providers have currently is the Fugilant at-home test kits as well, which is a PCR test. They're collecting the sample and they're mailing it to a lab and getting a result in 2 days, similar to, using their standard lab. But those are also free and they're in our warehouse. And I think we have like 7,000 of them there. Is that right, Christina? Yeah. We're doing well.
Something along those lines. We have plenty of stuff for everyone.
Yep. And then now I'll let Christina explain to you the latest development or tool in our potential toolbox, which is the point of care PCR test kit from Q. Take it away.
Great.
One
Thanks,
second
David.
before you go on, I see we have a couple questions in the Q&A. David, can we look at those first?
Nicole, actually, I have them open.
Excellent.
And I was planning to get to them. So
Oh.
there's a question about whether or not these tests are at a cost to you guys. And it's definitely no. Even if it may seem like that when you're checking out, everything will be free. Especially the Binax, the Q Health, at this point in time, everything is free. And Arnie Spangers from the Public Health Department also is asking, how many cross-checks are recommended to verify competence? So with these, with the Binax now, we're recommending that an individual or a facility tests about 30 to 40 people to make sure that it's working well in their hands, so that there's no cross-contamination or like false positives. There may be false negatives, which can occur because the antigen test is just less sensitive. But so far, of all the facilities that we're working with, when they use the antigen test and they also send testing for PCR in parallel, it's been matching up pretty well. So I think if you are working conscientiously, switching gloves between patients, making sure the dropper doesn't touch anything, then I think it will work well in your hands. And so I think those are the two questions I see so far. If there are other ones, please continue to send it to the chat or unmute yourself and ask the question. And so the second thing that I want to show you guys is this very simple, kind of looks like an Apple TV point of care PCR test that we got from Q Health. And this is a system where, unlike the antigen test, is actually a PCR test. So this can be confirmatory. All you need is for this to be Bluetooth linked to a phone. You need to download the app and you'll get the results right on your phone. You can connect 6 devices to one phone. Right now, I think it's only available on an iPhone or an iPad, but they are planning to do it on Android soon. And so what you would do is you would log into the app, and this is kind of hopefully people can kind of see that. I don't know, it's probably not very clear, but this is basically the app, and the app will walk you through the entire process. You basically want to begin the test. You want to make sure the reader is connected to an outlet so that it's warming up. You will, once it's ready, and you'll be guided through the whole process, and we have videos to provide people as well. Once it's ready, you take this cartridge, very simple cartridge, you insert it in here to let it warm up. Just clicks in, and it'll heat up and preheat. Once it says it's ready for you to take your swab, there is this handy little swab in here that you take. Similarly, you just take this, similar nasal swabs, probably five or seven twirls in the right nose, 5 or 7 twirls in the left nose. And then once it says you can insert the swab, all you do is put this directly into the hole right there. It'll snap in, and it'll say that the test is running. And it takes about 20 minutes. So the antigen test takes about 15 minutes, and this Q Health test takes about 20 minutes. The one reason to maybe utilize the antigen test if you're in a larger facility is because each individual card can be handed out to multiple people. Whereas one reader, once it's used and once it's been, once a sample goes in, it's 20 minutes before you can run the next sample. So if you're a large facility, then you may want multiple readers, and we can provide that for each facility. It is a program that's lasting through August, maybe September. It may be able to be provided longer, but we're not sure right now. But it is very handy. It could be utilized in conjunction with the antigen test. So let's just say you run an antigen test on a patient. The patient is asymptomatic. They were in a ward that had no COVID, but they're coming up positive. You could potentially use this as a confirmatory test to rule out or rule in whether or not they're actually COVID positive. Or if you have a patient who's extremely sick, but they're testing negative on the antigen test, you could similarly use this as a confirmatory test and see if they're really actually positive or negative, since it will be more sensitive than the antigen test. Similar to the antigen test, it's good to run things in parallel, just so that you ensure that you know how the instrument is working, that you're handling it properly. There are instructions on deconning or decontaminating the instrument and the proper use and everything like that. So it is also very, very simple and very straightforward. So I will stop there for further questions.
Yeah, do we have anything in the, are people using this for visitors? Some facilities certainly are. It's not a requirement to test visitors. However, we have plenty of visitors who willingly want to be tested or asked to be tested. And in that case, you can. Of course, if you were to get a positive, you accept the responsibility of reporting on behalf of the visitor's positive, and that becomes your responsibility, as the negative would as well. But certainly, if testing visitors enables safer access for your visitors, then we're all for it, but it's not a requirement. These are super positive developments in terms of testing to put into our toolbox. Without a doubt, waiting 2 to 3 days for a PCR test result to return hasn't been very kind on long-term care facilities during this pandemic. So the mere fact that we're about on the verge of providing all of our facilities with easy access to free point of care, immediate result test kits. This is exactly what we need to be much better positioned should we face another surge or another wave. Would anyone like to come off their mute and ask a question? Please don't get, intimidated by these test kits. They're very, very easy to use. And one of the best, features is how much less invasive this procedure is of collecting the specimen. For those of you who care for people living with Alzheimer's or other related dementias, when you have to do that very deep nasal swab, it's not a very pleasant experience for many of our residents. It's not even for me. So to have this option of even allowing a resident who can do it to just swab 3 times their inner nose, letting staff swab themselves with a less invasive procedure, getting results and information back in a timely manner about the test result. This is groundbreaking in terms of equipping you to prevent and mitigate COVID. Can you please share the website again where we can order the free test kits? Sure thing. Let me go ahead and share my screen one more time. Let's see. Hold on. Unless you have that handy. Do you have that handy, Christina, the website to order the test kits from our warehouse?
No, I thought it was in one of your slides.
Yeah, I'll get it for you. Just hold on a sec here.
Great. And then, yeah, I just wanted to make a plug with everyone. I mean, these tests, initially it may seem a little daunting if you've never run one before, but I promise you, once you start, you'll find that it's so easy. And if, since the numbers are relatively lower right now in terms of positivity, it might be the best time for you to start learning something. So in case there is another surge, you're already comfortable with the technology, you're comfortable with the instrument, you're comfortable with how to run it, and know where to access it. And this would be a perfect time for people to start getting into it. For the antigen test, I think like the PIN said, you may not need a CLIA waiver, which is great. For the Q Health PCR test, it technically has an over-the-counter designation. And so you technically don't need a CLIA waiver to run it. And while this program is free, we would love to send this out to facilities to be able to give you access to these devices. And yeah, used in conjunction, I think it can meet a lot of your testing needs, and it can be very fast and rapid and be able to give you answers right away.
Yeah, can you see my screen now?
Yep, we can see it, David.
Okay. And we will send the slides out immediately to the participants so that you'll be able to just click on this. And I'm preparing actually a communication piece that I'm going to send out to all the facilities that would also have this link. Okay, let's see. Any other questions? Anyone need to come off mute? Are other people as excited about this as I am? Okay. Well, that's really all we have for you today. Nicole, I wanted to check in to see if you had any announcements for the group.
I just want to say again, David, this is a big deal. You are 100% right on that. And I hope everyone chooses to take advantage of this in some way that works for their facility to lighten the load. You have been really transparent with us that we should expect there might be, reoccurrences, and we should be prepared with lots of tools in our tool belt. And so I want to thank you for bringing this opportunity to the community. And I hope everyone will choose to take advantage of this.
Great, thank you. And thank you, Christina, for all of your support of the facilities and for hopping on this webinar, so quickly. I really appreciate it. And for all of you, please, maintain these core principles. We can't let our guard down. The only thing that's changed so far is visitation and dining and group activities, but nothing else has changed. So let's stay vigilant. We don't want to experience another surge. And with that, you know how to get in touch with me. And we deeply respect all of you. We hold you in the highest esteem, and just keep on plugging away. And I'm sure we're going to get through this together. We don't have a scheduled webinar next week or the week after. Based on pins and changing guidance, we're going to kind of call these webinars as we need them. Certainly, you would expect at least once a month. There may be more. So please stay tuned, and I hope that you can join us again. And with that, I guess we'll sign off. Thank you, everybody.